Welcome to the San Felipe Del Rio Consolidated Independent School District Employee Benefits presentation. Your benefit plan year runs from January 1st to December 31st. It's important to protect you and your family from the unexpected and to plan for the future. San Felipe Del Rio CISD offers you a comprehensive program of benefits to help protect the health, wealth, and lifestyle of you, your family, and your dependents. Save a copy of your benefit guide. All contact information for your plans, including carrier contacts and district contacts, are available to you on this directory page in your benefit guide. Please reach out to the appropriate parties with any additional questions regarding your coverages. When you are ready to enroll in your benefits, please contact Professional Enrollment Concepts, or PEC, at 1-866-337-3572. Monday through Friday, 8 a.m. to 7 p.m., and Saturdays from 9 a.m. to 3 p.m. San Felipe Del Rio CISD utilizes Professional Enrollment Concepts, or PEC, for your enrollment. Benefit counselors will provide you with a detailed explanation of your entire benefit program. They will review your benefits with you on an individual, confidential basis. This benefits guidebook describes the highlights of San Felipe Del Rio CISD's benefit program in non-technical language. Included in this benefits guidebook is important information about each of the benefit plans offered to you and your family. It includes the benefits paid by San Felipe Del Rio CISD, as well as voluntary products which you can customize to meet your individual needs. But first, let's talk about eligibility. In order to be eligible for benefits, you must be a full-time employee working 20 or more hours per week. You must enroll in your benefits during the first 30 days of employment as a new hire or during open enrollment. Your dependents are also eligible for enrollment in qualified plans. Eligible dependents include your legal spouse, children to the age of 26 to include natural children, legally adopted children, stepchildren, a child of your child who is your dependent for federal income tax purposes, a child a participant has a court order to provide health coverage for, or a child of any age who is medically certified as disabled. Once you have made your benefit selections and enrollment ends, your coverages are locked in for the plan year. To make changes to your benefit selections, you must contact your benefits department within 31 days of a qualifying life event to make those changes. Qualifying life events include marriage, divorce, birth, death, gain or loss of coverage through your spouse, or a child turning 26 and losing eligibility status. For example, if you get married and want to add your spouse to coverage, you have 31 calendar days from the date on the marriage certificate to notify your benefits department and make the change. Let's review San Felipe Del Rio CISD's medical plan offerings. There are 3 plan options available through Blue Cross Blue Shield of Texas: the HMO1 plan, the HMO2 plan, and the PPO plan. We will review these at a high level with additional information available to you in the benefit guide. First, we'll discuss the difference between an HMO plan and a PPO plan. Under an HMO plan, members are required to receive all non-emergency care from network providers. This means no out-of-network coverage unless it is an emergency. All qualified emergencies will be treated as in-network. HMO plan participants are also required to select a primary care provider and receive a referral from that provider to schedule an appointment with a specialist. A PPO allows patients to choose between in-network providers and out-of-network providers. Patients who opt for an out-of-network provider are required to pay a higher share of their health care costs. A PPO plan also does not require the selection of a primary care provider or a referral to see a specialist. Please keep these descriptions in mind when choosing the best plan for you and your dependents. Now to review your benefit options. For employee-only coverage, the annual deductible is $2,500 on the HMO1 plan, $1,200 on the HMO2 plan, and $0 on the PPO plan. For employees also covering eligible dependents, the annual deductible is $5,000 on the HMO1 plan, $2,400 on the HMO2 plan, and $0 on the PPO plan. For employees only coverage, the maximum out-of-pocket is $8,000 on the HMO1 plan, $6,900 on the HMO2 plan, and $2,000 on the PPO plan. For employees also covering eligible dependents, the maximum out-of-pocket is $16,000 on the HMO1 plan, $13,800 on the HMO2 plan, and $6,000 on the PPO plan. The coinsurance on the HMO1 plan is 30%. This means once you reach your deductible, the plan will pay 70% and you will pay 30% until you reach your maximum out-of-pocket. Once you reach your maximum out-of-pocket amount, the plan will pay for covered services at 100%. The coinsurance on the HMO2 and the PPO plan is 20%. This means once you reach your deductible, the plan will pay 80% and you will pay 20% until you reach your maximum out-of-pocket. Once you reach your maximum out-of-pocket amount, the plan will pay for covered services at 100%. If you are enrolled in the PPO plan, you have a $0 deductible and will be subject to coinsurance for covered services not included in a copay. Your preventative care visits are covered at 100% on all three plans. Your MD Live virtual visits are available at a $0 copay for all three plans. Primary care visits are a $30 copay on the HMO1 plan, $15 copay on the HMO2 plan, and $25 copay on the PPO plan. This includes mental health visits. Specialist office visits are a $70 copay on the HMO1 and HMO2 plan and a $40 copay on the PPO plan. Urgent care is a $50 copay on all three plans. Emergency room visits are subject to deductible and coinsurance on the HMO1 and HMO2 plan. For the PPO plan, emergency room visits are subject to a $150 copay plus coinsurance. Inpatient and outpatient hospital services, as well as major labs such as MRIs and CAT scans, are subject to your deductible and coinsurance on all three plans. Outpatient diagnostic x-rays and lab services are covered at 100% on all three plans. Your copays for your prescriptions are as follows. For generic drugs, the copay is $15 on the HMO1 and HMO2 plans and $10 on the PPO plan. For preferred name brand drugs, the copay is $60 on the HMO1 and HMO2 plans and $35 on the PPO plan. For non-preferred name brand drugs, the copay is $100 on the HMO1 and HMO2 plans and $60 on the PPO plan. For specialty drugs, the copay is $200 on the HMO1 and HMO2 plans and covered under the generic, preferred, and non-preferred copay tiers for the PPO plan. Mail order prescriptions will be 3 times the retail copay. Once your coverage is active, do not forget to download the app. Please reference your digital benefit guide for instructions on how to register. On the app, you can review your explanation of benefits, find providers, print or request ID cards, and check on your deductible and out-of-pocket maximum status. If you prefer to access your account from the web browser, you will also have an online portal available to you. Please reference your digital benefit guide for instructions on how to register. In your portal, you can also review your explanation of benefits, find providers, print or request ID cards, and check on your deductible and out-of-pocket maximum status. Blue Cross Blue Shield of Texas also offers an app to manage your prescriptions. Download My Blue RX TX to manage your prescriptions, compare drug costs at different pharmacies, set reminders when it's time to refill your prescription, and much more. Please refer to your benefit guide for more information. For members with 90-day prescriptions, Express Scripts Pharmacy through Blue Cross Blue Shield of Texas is available to you and delivers your medicines right to your door. Please reference your benefit guide for more information. No matter what health plan option you choose, chances are you and your family will incur out-of-pocket costs in the form of deductibles, copays, and coinsurance. The Healthcare Flexible Spending Account dollars can be used to pay for these expenses for you, your spouse, and eligible children. You can choose to contribute up to the maximum of $3,300 per plan year. These dollars are taken pre-tax and tax-free from your paycheck. Also, if you do not use all of your funds, up to $660 can roll over to the following plan year as long as you re-enroll. You must re-enroll each year in order to qualify for the rollover. There is also the option of a dependent care spending account. These can be used to pay for daycare expenses for qualifying children under the age of 13, or your spouse, a qualified child over the age of 13, or a qualified relative that is physically or mentally unable to care for themselves who shares the same residence with you. You can set aside up to $5,000 if single or married and filing jointly, or $2,500 if married and filing separately. These dollars are also deducted pre-tax and tax-free for use in your care for your qualified dependent. If you choose to elect the Healthcare Flexible Spending Account or Dependent Care Spending Account, register with Proficient Benefits to easily see your account details and balances, as well as submit claims and receipt documentation. The portal will also have comprehensive decision support tools to help you make critical spending and saving decisions for you and your family. You can also access your Proficient benefits and balances via the Benefits Connect app. Reference your benefit guide for more information and how to download the app. Your dental coverage is offered through MetLife with 3 different plan options: the low plan, mid plan, and high plan. The yearly deductible for all plans for an individual is $50, and for family it's $150. The annual maximum for the low plan is $1,000. The mid plan is $3,000, and the high plan is $5,000. These amounts are per covered member and is the maximum the plan will pay out towards your covered dental services. Preventive services including oral exams, cleanings, x-rays, fluoride treatments, and space maintainers are covered at 100%. On all 3 plans, basic services are covered at 80% and major services are covered at 50%. On the low and mid plans, endodontics and periodontics are covered at 50%. On the high plan, they are covered at 80%. Please note that if you use an out-of-network provider, you will have a higher cost share than with an in-network provider. Orthodontic services are covered at 50% on all 3 plans, with a separate lifetime maximum of $1,000 on the low plan, $1,500 on the mid plan, and $2,000 on the high plan. Orthodontic services are available to adults and covered dependents. Dental insurance works backwards from medical insurance. Medical has the most you will pay out of pocket, and dental has the most they will pay out of pocket. For example, on the low plan, if you have a basic service performed and the bill is $1,000, you will pay $200 and then the plan will pay $800. If you then have a major service performed and receive an additional bill of $2,000, the plan will pay $200, reaching their maximum of $1,000, and you will pay the remaining balance of $1,800. Visit www.metlife.com/mybenefits to register for your portal, which provides access to your balances and benefits, as well as a way to search for in-network providers. San Felipe Del Rio CISD offers voluntary vision coverage through Itopia. There are 2 plan options available. Under the 120/145 plan, the copay for your yearly exam is $10. For lenses, your copay is $20. You can replace your frames once every 12 months, and you will receive a $120 allowance towards your frames. For contact lenses, if they are medically necessary, there will be a $145 evaluation allowance and a $400 contact lens allowance. For elective contact lenses, you will receive a $145 allowance towards your contact lenses after the $20 lens copay once a year. Under the 180/300 plan, the copay for your yearly exam is $5. Lenses for your glasses are a $0 copay. You can replace your frames once every 12 months, and you will receive a $180 allowance towards your frames. For contact lenses, if they are medically necessary, there will be a $250 evaluation allowance and a $400 contact lens allowance. For elective contact lenses, you will receive a $300 allowance towards your contact lenses and fittings once a year. Please note, the lens copay for your glasses is only for the lenses themselves. If you wish to add extras such as scratch-resistant coatings or transition lenses, these extras come at an additional cost. It is important to see an in-network provider to take advantage of the contracted savings through Itopia for these types of add-ons and to save yourself the most money possible. San Felipe Del Rio CISD provides all eligible employees with a $10,000 basic life and accidental death and dismemberment policy. This policy stays active as long as you're employed. If you were to pass away in an accident, this policy would pay an additional $10,000, totaling to $20,000. San Felipe Del Rio CISD employees also have the option to purchase additional term life and AD&D insurance through the standard. Employees may choose to purchase additional life and AD&D benefits in increments of $10,000 to a maximum of $500,000. Employees may also choose to purchase coverage for their spouse in increments of $5,000 up to $250,000, not to exceed the employee's benefit amount. For children to age 26, a flat $5,000 or $10,000 policy can be purchased. For new employees enrolling for the first time, you may elect coverage up to the guaranteed issue amount without having to complete an evidence of insurability form. For those already enrolled, you may increase your coverage for yourself and your spouse by one increment up to the guaranteed issue amount without having to complete an evidence of insurability form. Once you increase over the guaranteed issue amount, you must complete an evidence of insurability form. If you are a late entrant, meaning you've gone through enrollment before and previously denied this coverage, you will have to complete an evidence of insurability form to enroll. The guaranteed issue amount for employees is $200,000, and for spouses, it's $50,000. Both policies have an age reduction of 50% at age 70. Trustmark's fully portable universal life solutions addresses differing employees' needs for permanent life insurance and peace of mind for a lifetime, and are available for employees and their spouses and children in face amounts of $5,000 up to $300,000. The universal life events pays a higher death benefit during the working years when expenses are high and families need maximum protection. At age 70, when financial needs are typically lower, the death benefit reduces to 1/3. However, higher living benefits do not reduce. They continue through retirement to match the greater need for long-term care. The spouse and domestic partner benefit guarantees increases to both living and death benefits without underwriting to age 60. The terminal illness benefit accelerates 75% of the death benefit amount when life expectancy is 24 months or less, as compared to 50% or a 6 to 12-month life expectancy is commonly seen in the industry. Accelerated death benefit or critical care benefit is designed to accelerate death benefit at 4% per month for up to 25 months to pay for long-term care in an assisted living or long-term care facility, or home health care or adult daycare. If you and your family are active, chances are you are no stranger to a hospital emergency room, and considering accident insurance may help with these emergency events. Even with medical insurance, a fall while bicycle riding or your child's sprained ankle at a soccer practice can cost you a bundle in out-of-pocket expenses. Are you financially prepared for all of the medical and non-medical costs of treatment and recovery from a serious injury? Guardian pays direct to you cash benefits based on covered injuries, treatments, and services. Examples include lacerations, which pay up to $400 on Plan 1, fractures up to $6,000 on Plan 2, and even hospital admission, which pays $1,000 on Plan 1 and $1,250 on Plan 2. If you enroll in this benefit, don't forget your yearly physical qualifies you for a $50 wellness benefit once per calendar year per covered person. Contact Guardian to file your claim. Critical illness coverage through Guardian is a percentage-based benefit that pays cash directly to employees for eligible diagnoses, such as a heart attack, stroke, or organ failure. For example, if a member enrolls in this plan with the $10,000 benefit and has a heart attacks are paid at 100%, so the member would receive a $10,000 payment. If the same enrolled member is diagnosed with Addison's disease, which is paid at 30%, the amount received would be $3,000. This coverage can be purchased in $5,000 increments up to $20,000 for employees, $10,000 for spouses, and 25% of the employee amount for children. Spouse coverage cannot exceed 50% of the employee's coverage. Please note there are pre-existing condition limitations associated with this coverage. The 3-month look-back period is to confirm full-time status, averaging at least 20 hours per week. You must be 6 months treatment-free, meaning you did not receive medical advice, a diagnosis, care, or treatment for the illness prior to enrolling. If you did receive treatment within the 6 months prior to enrolling, you must be enrolled in the plan for 12 months to receive benefits for that diagnosis. If you enroll in this benefit, don't forget your yearly physical qualifies you for a $50 wellness benefit once per calendar year per covered person. Contact Guardian to file the claim. When you hear that you have cancer, you think about a lot of things. The one thing you don't want to think about is how to pay for all of the expenses that come from your medical care and recovery. Guardian's cancer coverage can help with unexpected costs. Medical insurance plans may cover many of the expenses associated with a cancer diagnosis. However, there are many non-medical costs associated with your recovery, such as transportation to treatment, childcare, and lost wages due to your inability to work. This plan pays cash benefits to you for covered services and treatments. Some examples include an initial diagnosis benefit of $1,500 on both Plan 1 and Plan 2. It also includes a hospital confinement benefit of up to $300 a day for the first 30 days and $600 a day thereafter on Plan 1, and $400 a day for the first 30 days and $800 a day thereafter on Plan 2. Please note there are pre-existing condition limitations associated with this coverage. The 3-month look-back period is to confirm full-time status, averaging at least 20 hours per week. You must be treatment-free, meaning you did not receive medical advice, a diagnosis, care, or treatment for the illness prior to enrolling. If you did receive the treatment prior to enrolling, you must be enrolled in the plan for 12 months to receive benefits for that diagnosis. If you enroll in this benefit, completing a cancer screening will qualify you for a $50 wellness benefit once per calendar year per covered person. Contact Guardian to file the claim. Voya Protect is a voluntary coverage that will help to bridge the gap of increased deductibles. Benefits are triggered by the ICD-10 codes from your treatment, and over 13,000 ICD-10 codes are covered. These codes are used by providers to categorize your injury and/or illness and the treatment that was performed. Members will be able to file claims for moderate, severe, and catastrophic injuries or illnesses. An example of a moderate injury or illness would be a simple fracture, laceration, or dehydration. An example of severe injury or illness would be a compound fracture, torn ACL, or appendicitis. An example of a catastrophic injury or illness would be malignant lung cancer, heart attacks, or organ failure. For catastrophic injury or illness, the same ICD-10 code can only be used 3 times in a lifetime. This means if you have 4 heart attacks with the same ICD-10 code, you will only be able to file claims on the first 3. If you have 3 or more catastrophic claims with different ICD-10 codes, you will be able to file a claim for each one. The amount of the payment for your claim will depend on which category it falls into and which plan you select. For example, if you suffer a severe injury and are enrolled in the Enhanced plan, you will receive a $1,000 payment. If you suffer from a catastrophic illness and are enrolled in the Premier plan, you will receive a $5,000 payment. Submitting a claim is easy through your online portal, and benefits are typically paid within 72 hours if the claim is approved. A claim can be submitted either with your explanation of benefits or with a detailed receipt from the provider's office that includes ICD-10 codes. Please see your digital benefit guide for more information regarding this benefit. Disability insurance is coverage for your income. If you are injured or become ill and are unable to work, this benefit will pay you up to 66 2/3% of your monthly earnings, not to exceed $7,500. You can purchase this coverage in $100 increments with a minimum of $200. You also have the choice of deciding your elimination period. For example, if you choose the 14-day elimination period, you can file a disability claim on the 15th day of not working due to injury or sickness. If you choose the 90-day elimination period, you can file a claim on the 91st day of not working due to injury or sickness. If you choose the 7, 14, or 30-day waiting period and are admitted to the hospital as inpatient, your waiting period will be waived and you can immediately file a claim. You must be under the regular care of a physician in order to be considered disabled. If you become disabled and are no longer able to work indefinitely, this benefit will continue to pay until Social Security retirement age. Exclusions for pre-existing conditions may apply. Please reference your benefit guide to contact the standard for more information. San Felipe Del Rio CISD provides an Employee Assistance Program, or EAP, to all eligible employees at no cost. The Support Link EAP is available to employees, their dependents, and household members. This program offers a wide variety of counseling, referral, and consultation services, which are all designed to assist you and your family in resolving work and life issues in order to live happier, healthier, and more balanced lives. From stress, addiction, and change management to locating child care facilities, legal assistance, and financial challenges, Support Link's qualified professionals are there to help. These services are completely confidential and can be accessed 24/7, offering you around-the-clock assistance for all of life's challenges. A copy of your annual legal notices, including your rights as the insured, can be found in your benefit guide. Please reference your guide for more information. This concludes San Felipe Del Rio CISD's benefit program presentation. Remember to download your benefit guide to review all of the information discussed here today, as well as additional information such as helpful insurance terms and frequently asked questions. San Felipe Del Rio CISD strives to provide the best benefits available to its employees. We hope this presentation has helped in your decision-making for your enrollments, and we thank you for your time. For further questions, please contact your benefits department at 830-778-4100.